The action potential is a unique feature of excitable cells, such as nerve and muscle cells, not to mention a very popular physiology exam question. Before we discuss the action potential, we need to bear in mind two givens. First, that the interior of the cell is negatively charged compared to the exterior of the cell, which is positively charged. Second, there are more sodium ions outside of the cell, and there are more potassium ions inside of the cell. When the cell is at rest, its resting membrane potential, or RMP, which is the electrical potential difference across the cell membrane with respect to the interior, is therefore negative. Specifically, the RMP is around negative 70 millivolts. At rest, the cell membrane's permeability to sodium is low. However, its permeability to potassium is high. And because there are more potassium ions inside the cell, naturally the potassium ions will diffuse or move out of the cell, therefore keeping the RMP negative. However, when an inward current reaches the cell, usually from another action potential from a neighboring site, the inward current will depolarize the cell membrane. Depolarization means that the interior of the cell becomes less negative. When the membrane potential reaches approximately negative 55 millivolts, which we call the threshold potential or TP, there will be rapid opening of the activation gates of sodium channels. Therefore, sodium permeability increases, prompting sodium ions to enter the cell, making the interior of the cell even less negative. However, it's important to note that this depolarization event also causes the inactivation gates of the sodium channels to close, the result of which is to close the sodium channels. However, the closing of these inactivation gates is delayed compared to the opening of the activation gates. Second, the depolarization event also causes potassium channels to open up, allowing potassium ions to yet again exit the cell. Thus, eventually, the upstroke of the depolarization is terminated and the membrane potential will be made more negative again. This step is called repolarization. Interestingly, for a brief period of time after repolarization, the conductance of potassium ions will be even higher than at rest, and the membrane potential becomes even more negative than usual. This is called the hyperpolarizing after potential stage, or undershoot. Eventually, though, the conductance to potassium will go back to its normal resting level, and the membrane potential will be back to the RMP, which is around negative 70 millivolts.